Hello, my name is Isaiah G. Simon. I'm a marketing major at Nova Southeastern University. I'm doing a presentation for my nutritional neuroscience class. Um, basically my presentation is going to be about how creatine affects neurological diseases. Let me share my screen. So before I get into the articles I found, I want to talk about what creatine is. So creatine is basically it's an organic compound. It's usually used for muscle building, but it's also here. It says it's primarily used in muscle and brain tissue. Mostly people use creatine for muscle building and things like that. So basically working out. It's not like um, it's almost like a supplement to induce like to get your muscle pumping and things like that. It's not really like a supplement to I forgot what the supplement's called, but it's not one of those like supplements where you sniff and then you get like this burst of energy. It's not one of those, but it could help uh, bring energy back to your muscles. Like, um, so my first article talks about effects of creatine supplementation on brain function and health. Here are the authors of the article here. And they basically talk about basically my topic. Um, so how creatine affects the brain and how it benefits the brain function. And um, in doing so, they found that certain studies found creatine having the ability to increase brain creatine content in humans. It has also shown a promise for attenuating symptoms of concussion, mild traumatic brain injury, and depression. Um, Although there are other supplements and maybe like medication that people take for these things, but those medications are not always organic, like creatine. So, some people think that creatine is mostly used for muscle building, can also be used to help with depression and uh, concussions and things like that that people suffer through maybe almost every day or once in their life. Um, my next article talks about functions and effects of creatine in the nervous system. Here are the authors here of the article. In respect to the authors, I will not try to pronounce the names, but it's here. Um, so this article basically touches up on how creatine affects the nervous system. Um, and in doing so, they did a study on creatine and how it affects the nervous system. And in doing so, they found that creatine plays a significant role in the central nervous system. Um, they found that functional impairment of the system leads to reduce neuronal cell loss and experimental uh, parad paradigms of acute and chronic neurological diseases. Also, they found that creatine has shows benefit effects of therapeutic creatine supplementation. So they found that basically uh, creatine could be used to promote differentiation of neuronal precursor cells that might be of importance for improving neuronal cell replacement strategies. And based on this, they found again that creatine has positive effects on nervous system. For my next article, it talks about how creatine is beyond the muscle. So basically beyond building muscle, that the main purpose of, or not the main purpose, but one of the purposes of creatine. Um, this article was published 2019, uh, February 19th, 2019. Here are the authors here. These are the authors. And they basically did a study on same thing like the first article, how creatine affects the brain. And in doing so, they found that creatine influences a situation where cognitive processes are needed. So things like sleep deprivation or experimental hypoxia um, are more complex cognitive tasks. Uh, Creatine can help patients or people perform those tasks or perform those things, or maybe go to sleep and things like, well, not go to sleep, but lack of sleep and lack of energy and help boost it. Um, it says here also evidence exists indicating that increased brain creatine may be effective at reducing the severity of or enhancing recovery from mild traumatic brain injury. However, only limited data in humans are available to verify this hypothesis um, for, for further research. Um, but despite um, the much more needed research, it's still shown that uh, creatine can help with traumatic brain injury, sleep deprivation, and things like that. So how does this relate to me? I see creatine. Well, I just started taking creatine for muscle building, and I never understood what its purpose was until I found these articles. So now that I found these articles, I feel like creatine is just beyond me taking it to go to the gym. That I could also take creatine for maybe if I need a boost of energy, or if I'm gonna do a hard task, maybe if I'm gonna go to school and I need some energy. Um, Besides working out, I'll probably take me maybe one or two scoops of creatine before I go to school or before I do some work or things like that. Or maybe if I'm, depressed, maybe I could take a little bit of creatine and possibly that could help me with with my task. Thank you for watching my presentation, and have a good day.